Well, Harvey, you're joining us, and it's very kind of you. And first of all, we'd like to know where you are in the world, please.
Okay, well, I'm in Israel. I'm in a town called Ra'anana, which is about 20 minutes out of Tel Aviv, not far from the Mediterranean. Nice little town, sort of a middle-class town, Jewish population, quite a few immigrants from the Western countries are here.
So fairly cosmopolitan by the sounds of it.
Yeah, good place to be.
So it's January. What is the temperature there now?
You'll be very jealous to know it's like 2022 every day. Beautiful Israeli winter.
I could live.
We haven't had rain for a few weeks. We look forward to rain in the summer because in the winter it's very dry all year. Yeah. And it's been dry for a bit. The weather's beautiful.
Well, here it probably got up to about 3, so I am incredibly jealous. That is. Well, what's your day job, Harvey?
I'm a GP or family physician, it's called here. I work for one of the HMOs, we have like an NHS here, but there are 4 different health maintenance organisations. And I work 6-7 hours a day. It's a 10-minute walk from home. What a nice little life. As long as patients don't recognise me on the way to work.
That's always the problem, okay. Isn't it? Just have a quick look at this doctor. Yeah.
Yes, I'm coming to see you tomorrow. Thanks for the warning.
Yeah. So you've been. How long have you lived in Israel for?
32 years, since I was 28.
Okay.
I grew up in Melbourne and studied medicine at Monash University. I've been here. Here I did the training in family medicine and been here ever since.
Right, okay, cool. Right, good. So basically what I was trying to establish is you've been there, you know how the Israeli systems work, and you've been there from the start of the pandemic. When did you first hear the term coronavirus?
It's hard to remember, things are building up until it was declared. Probably January I heard the name and didn't give another thought to it.
Yeah.
February things started to look interesting. I think the end of February, when things were looking, I don't understand what's going on here. A friend that I studied medicine with, who's now an eye surgeon in Melbourne, said, get on to this guy, John Campbell. He gives a good spiel every day. You'll know what's going on. Right. And I'd like to say I haven't left you since, but I did break up with you, I think, in September. It was too intense, John. I needed a break.
I'm not surprised. I probably needed one as well, to be quite honest. So you've seen but basically sketch out the pandemic, Harvey, in Israel. That there was.
Well, we did. We probably reacted pretty quickly, and closed the borders.
Yes.
And I think we had a lockdown for 3-4 weeks. It was very dramatic, as it was in most places in the world when it happened. So the borders were closed down more or less. Israelis could come home. You could go 500 meters from your home. Everything was closed except for, food and supermarkets and surgeries, whatever. I went to work every day, even if it was for an hour. A lot of patients feared to venture out, and I could work from home. I can do some remote work. It was a scary time, actually, and we got the numbers down very well, very quickly, and we felt very proud of ourselves after the first lockdown.
So that's talking March, April time, is it?
That's right, March, April.
Yeah, and then things got quite a bit better.
Things were great for a while, and of course we just thought we won. Israel's had a number of wars over the years, and we all get together and bear down and fight the hard fight. But we're used to doing it for a short period of time, and then we won. Yeah. Mm-hmm. And the numbers, we opened up too quickly, and the numbers quickly came up, and by, I think, August, we were getting into trouble again. And that was the second lockdown. Now we're in the third one, which is just going to become stricter tomorrow.
Right, I remember August absolutely scooted up, didn't it? There was a really rapid increase in rate, and you got it down quickly.
Yeah, you remember better than I, John.
So what is the state now? You're going to a stricter lockdown tomorrow?
The last week, if I remember, everything's a bit blurry. It was a lockdown, which meant most businesses are closed. You can work if you're not. You can travel to work if you don't receive people inside your office or shop. You're supposed to have half the staff only present. No reception of people. You can go to supermarkets, doctors. You can go and get vaccinated, which we're going to talk about in a minute. And people are not taking it seriously. You're only allowed to move 1 kilometre from home. The traffic is 80%, 90% of normal. We can tell from the Waze app how much people are out and about.
Really?
Not taking it seriously.
So is that a failure of public health education, or can you identify the problem there?
I think firstly people are worn out, like they are in most places in the world, human nature. Secondly, lots of politics behind this, and the government deciding they're going to close this, but no, we're going to open that, and then there's public pressure, and they keep changing their mind. There's not one consistent message. Hold the line. There's been cases of poor examples by public figures, also in England, also in Australia.
Indeed.
So
and the States,
bugger this. I'm going to do what I want to do. And some stuff doesn't make sense, as long as there's an argument to be said. If I'm not near anybody and I'm safe, so let's go.
That's right. I mean, when you have public health measures that don't seem to make sense and people aren't going to comply with them because they're not, it's not relating to the individual. That's right. I mean, has there only been any particular drivers of infection, any particular communities or areas that have caused a lot of infection in Israel?
Yes, I think probably two populations have been topical. One is the ultra-Orthodox or Haredi populations. They've got a higher rate. I think they're 25% of the cases at the moment, but probably 15% of the population.
So they just carried on with the meetings regardless, did they?
They still want to study together. There's a bit of distrust against part of the government. They are part of the government as well. There's some faith issues. If this is divine, then we need to keep practicing our religion. I'm generalizing here.
Yeah.
And they also tend to have larger families and live in smaller accommodation and be much more communal. So they get together and it's crowded. It's winter now, even though our winter is mild. So that probably that's probably part of it. Some of them also, some rabbis were a bit equivocal about how serious this is in the beginning, and they tend to follow some rabbis, some of the various sects, and some of them are not a small proportion, are not connected to the outside world like the rest of the population with internet and news information.
Right. Yeah.
Filtered.
And the other segment, you mentioned there was two segments.
Some have the Arab populations. There have been periods of time where their numbers have been much higher. And that's probably also partly political because of the history of the country where part of that population has felt and has been discriminated against. So they may not feel so much part of the country, and we'll look after, we're more autonomous. We'll do what we think is right. That's changed now. The rate amongst the Arabs right now is lower than the general population. It goes up and down.
Good. Right. Okay.
Yeah, at the moment.
So getting onto the vaccination issue now, Harvey, Israel is streaks ahead of anyone else. Well, why is Israel doing so well in terms of per capita vaccination?
Yeah, well, that's really fascinating that we're doing, at the same time, it's the race of the vaccine versus the virus.
Yes.
And the virus has got many advantages, as you know, you've discussed. So there's a few things here that I noted.
Yep.
One is there's universal health care here.
Yep.
Every citizen is a member of one of 4 of these funds. And the funds are well respected, well run, and they're used to giving mass vaccines. They're used to these vaccination programs. The health fund I work for, which is called Maccabi, rehearsed this so wonderfully by giving the flu vaccine in the last 2 or 3 months in sort of the outdoorish areas, not in the regular clinics. And they had the whole logistics set up and the organisations and reaching out directly to people, telling them when to come in. It was all done very safely and efficiently. So we're repeating it now with the COVID vaccine. People trust the health funds.
So
people are happy with them.
When you say universal, I mean, I think what a lot of people don't realise, certainly in Europe and in the UK, they don't realise that the diverse nature of the population in Israel. I mean, I know just from common knowledge that there's Jews, obviously, ethnic Jews. There's ethnic Arabs, Druze, and Armenians in Israel. So when you say universal, does the healthcare provision cover all of those people groups?
Yeah, of course.
Yeah,
of course. Yeah, you can see there's photographs of the immunization in Arab towns where the signs in the background are in Hebrew and in Arabic. In my town, where I don't know that any Arabs live here, of course they can. Anybody can live in this city, of course. Some of the nurses, some of the doctors are Arab. Arab patients can come to my town to get vaccinated as well. You just got to book it. You book it online, or you call the health fund, and everybody can go and get the vaccine. Some Jews go into Arab towns because the uptake was a bit slower in the beginning amongst Arabs in Arab towns. Everybody's entitled to. Everybody gets good health care here in Israel. All the citizens, Jews, Arabs, and everybody else.
I think a lot of people find that reassuring because Israel is often criticised for treating different people groups differently, but you're saying all the ethnic groups in Israel are treated exactly the same.
Inside the state of Israel, which is not the same as in the occupied or West Bank or the Palestinian territories, that's something else.
Right. Okay.
But the 25% of the population who are Israeli Arabs get same access to healthcare, of course.
But actually, in the nation of Israel, that all happens the same. That's good to know.
Sure.
Yeah. So I mean, I think is it the Pfizer vaccine? I think you're using mostly. Is it at the moment? Is it?
We've got it's only Pfizer. We just signed with Moderna. That's on its way. AstraZeneca will come. I should tell you another factor is we reached out to the drug manufacturers early. Because we're a small country, it's much easier to organise this sort of project. I think Israel's an attractive country for drug companies to start the campaign of vaccine because you can monitor them very easily. They can get them out easily. We can monitor side effects easily
because of the universal health system means that there's provision for that.
But it also benefits the drug companies. They're going to get good information quickly about how the vaccination works here amongst a large number of people. We've done 60% of 60-year-olds already. We've done
60% of over 60s.
We've done 15% of the population as of today, as far as I know. It's pretty amazing. I'm getting my second shot. Because I'm a doctor, we were vaccinated on the first day, the day after our Prime Minister bravely had the vaccine.
Yeah.
And I'm getting my second shot on Sunday. And a week later, I'm officially immune. Most of me, anyway. 95% of me.
Marvellous.
Yeah, it's a great feeling.
Yeah. Well, we think we expect about 95% efficacy, but about 95% efficacy, we think.
That is exciting.
But it looks very unlikely after 2 doses that you're going to get sick. If you do get it, it's likely to be mild. So it's I am very jealous, Harvey, of the weather and of your vaccination status. I wish mine was up there with you. Now, in your medical work, are you seeing many people reporting with COVID for?
Well, there's a bit of hysteria from time to time about, especially in the early days, about getting the test done. Not everybody could get it done in the beginning, but now you can just go online and get your own test.
Is this a PCR test?
Pardon me?
PCR test.
Yeah, the PCR test. That's accessible. You can usually get it the same day or the next day. You can easy. And the pressure now is people who want the vaccine because you're supposed to be 60 plus or 55 plus with some chronic illness, and some people get in a bit younger and some people don't seem to be able to get it. There's a huge demand for it after some skepticism by the general public when it was on its way. People saying, I don't know if I want to take it. That's sort of universal, but demand is really through the roof. We are going to slow down the first vaccines. There's going to be a slowdown of vaccination now. They're just going to concentrate on getting the second one in the next few weeks, and then there'll be a new lot coming in for the younger folk.
Right.
It's pretty good.
So the plan is to vaccinate everyone over the age of 16 in the country, is it?
Yeah. Eventually, yeah, sure. And maybe even younger when, there's new vaccines.
Yeah,
younger people.
When they're licensed for children, as they will be, I'm sure, eventually. So Israel's going to be the first country to reach herd immunity through vaccination, isn't it?
Looks like it. Wow. Yeah,
and what a fascinating case study for the world, because we're dealing with quite a large sample size. I mean, the population of Israel is just over 9 million now, from memory. It's,
yeah, you're right.
So it's actually a pretty good. It's a pretty interesting experiment. The data will be there and act as a model for all other countries in the world, really, and be able to collect differential data between the Pfizer, the Moderna, and do you know when you're getting the Oxford AstraZeneca actually?
No, but it's coming. I think I can't remember. Moderna's going to come later this month.
Right.
AstraZeneca, I don't remember, but that'll come.
Right. No, that's just such good news. Very, very good news.
We should have a good spring. I hope so.
I mean, you're just going to get there so much earlier than anyone else. It's going to be so. It really is a glimpse into the future, I think.
Yeah.
So No, sorry, go ahead, Harvey, sorry.
I was going to tell you, so there are going to be these green passports that we've been talking about now.
Right, okay.
You know about this is about. So currently, if you have had the virus or the vaccine, then you will get a green passport, which means you don't have to go into lockdown or isolation if you're exposed. You should be able to go to various public events. And go overseas. And apparently we're negotiating with 10 other countries at the moment who may well accept our green passport so we can do what Israelis love to do, which is to go overseas.
That is very interesting. I didn't know that. So it looks like other countries are probably going to have this green passport as well. There'll be reciprocal agreements.
Sure.
And it means that an increasing segment of the population can get back to normal.
Yeah, and that's a good. That's a big incentive for Israelis also to get the vaccine, because Israelis love to travel.
Indeed. So there's not really a sort of an anti-vaccine lobby in Israel like there is in the United States, for example, or parts of Europe.
I'm sure not. I've seen none. I have a few people who are reluctant, and I just think that's bad luck for you guys.
Yeah, absolutely.
If you don't want to do it, I reckon they'll come around to it. I can understand a bit of hesitancy, but I think that's waning as well.
Mm-hmm. Now given that you've been vaccinated now, Harvey, and okay, we know you're not immune yet. You've got the second dose to go. You've got to wait your 7 to 10 days after your second dose. Mm-hmm. But people that are in that position, will you still be advising that they take all the social distancing, the hygiene precautions, the mask wearing precautions that everyone else takes?
Look, I think until... of course, what I want to do is run around without my mask on and hug people that I haven't hugged for the last year.
Absolutely.
But I'll only do that behind closed doors because I don't want to show a bad example.
Yeah.
I think we still have to be careful until there's herd immunity.
Yeah.
Then we need to be careful. I don't mind walking around with a mask.
Yeah. I think this is an important point. When people are vaccinated, the behaviour shouldn't change. Basically until national governments say it's time to start relaxing the measures, and until then we're behaving the same way.
Mm-hmm.
Yeah.
Mm-hmm.
So patients that are coming to you feeling unwell with COVID, Harvey, what are the sort of most common clinical features that they're complaining of?
Okay. Well, most people don't come because they know not to come, so they can contact me, phone me, or whatever.
Okay.
People come in and say, well, firstly, half of them, I just get a result that they're positive because they've realised they're unwell or they've been exposed. They do the test. Some people, a woman came in today, a young woman, say, I've got a sore throat. I don't feel so good. Okay, it sounds like a virus. Goodbye.
Yeah,
and
absolutely.
I send them a referral.
You just send them straight for testing.
Yeah, I said, go home, be in isolation. You get a link, or the HMO will call you, and you'll go and do the test probably today. Be in isolation until it comes back negative.
Yeah.
And oftentimes it's negative. So occasionally it's positive. People know what to do. They don't panic anymore. We're a bit used to it.
Right. That's good. And of your patients, what sort of proportion are getting sick enough to be hospitalised?
I think probably 1 out of 200. Very few. Very few.
That is actually very good, isn't it? So we're talking about 0.5% or something. Yeah.
Yeah, very small. Where Israelis in general there's a lot of young people in Israel compared
Part of the
to say
demographic.
European countries.
Yeah.
The demographics are a bit lower.
Yeah.
And the younger people are more likely to get it because of behaviour.
Yes.
And get it less severe.
Yes. And it's a sunny country, Israel, isn't it?
Yeah, people are still outdoors. I was outdoors in shorts. Sorry, John. Shorts and T-shirt today. And
it's okay.
A lot of people live outside. It's great.
So we would assume from that the average vitamin D levels in Israel are significantly higher than they are in the frozen north where I live.
Well, I don't know the stats, but I can tell you lots of my patients are low. And I was plugging vitamin D before you were for general health, but I certainly subscribe to 2,000 or 3,000 units a day for most everybody.
Right, yeah. Interesting. So even in a sunny country like Israel, presumably because people are working indoors and things like that, it's more common.
Yeah. When we used to work in the fields and die at 30, we probably had a high vitamin D. That was a long time ago.
Yeah. So 2,000 to 3,000 units is still roughly what we're looking at in Israel, even though it is a sunnier climate. That's interesting. Yeah. Now, what are the hospitals like in Israel? Are they struggling at the moment?
Well, yes, they're filling up. I can't give you the numbers. Every week the health minister is saying, oh my God, we're about to be overwhelmed. And it's getting close, which is probably why we are getting slapped on the wrist now. And we're going to have 2 weeks of a more serious lockdown, in theory, while we race to get the vaccines. But there's still, I think there's 800 people in intensive care. Could there be 800? I'll have to do the math. I heard the number of 800.
It could well be, yeah. So
there's 800. Not insignificant.
It's quite a lot per capita.
Yeah, the hospitals are coping still, but it's getting close. And it's going to keep going up. We went up to 8,000 cases today diagnosed. That's a lot. It's going to double in 2 weeks. Even if we continue this rapid vaccination, it's any gains in the vaccination is lost because of the increased cases. Now, so that's why we need to lock down.
It really is. We really need both strategies at the moment, don't we? Flat out on the vaccines, of course, but all the behavioural stuff has to go because.
Yeah.
I mean, when do you think the vaccines are going to start making a real difference to transmission? You know, when do you think you're going to be getting near herd immunity levels?
I think we're talking about 70-80%.
Yeah.
Of vaccinated or recovered. We've got more people vaccinated than had the virus.
Right. That's
pretty
good. Yeah.
So those numbers will accumulate, but as you know, you need about 70-80% is probably pretty good. When will that be? Probably 2 months. I don't know. Probably a couple of months yet.
Well, I mean that's something that all of the countries in the world would be jealous of if it is that quickly. That is just brilliant. Of your patients, are you seeing anyone with sort of protracted long COVID type symptoms?
Probably only a couple. I mean, that doesn't mean some people may just be grinning and bearing it, although that's not usually the Israeli character. They would like to come and tell the doctor. Severe, I've only got one woman who got it in America who never was proven COVID-19 positive. They weren't offering the test then. She suffered for months and she was very deconditioned, had problems walking. She's doing much better now. But last month, a few people with lost smell for longer than they would like, which is quite debilitating. We don't realise how uncomfortable that is. But not so many. I know that up to 5% can get it from you. I mean, the stats from you. But people are not complaining about it, to me.
But there again, as an individual GP, you don't get sometimes a bit of a selective sample that you get. But I mean, but let's hope it stays that way. That would be really good news. So just to finish off, Harvey, I mean, are you optimistic about the next few months? You see things in Israel going well?
Yeah, as long as the hospitals don't become overwhelmed, that's the problem. It's getting close. I think we probably have more reserve than we would like to admit, but it's scary because it's doubling every 2 weeks. if we manage to get through the next month, then I would expect we're going to come out looking pretty good in 2 months on top of it.
So you're looking at struggling for the next month to 2 months, whereas other countries are looking at struggling for quite a bit longer than that.
Yeah, I think so.
Yeah, I think the country with the second highest vaccination rate is Bahrain at the moment.
Yeah, Bahrain, also small, also got a lot of vaccines. Wonderful.
Yeah. So Israel first, Bahrain second at the moment, and I think. Yeah, I think Saudi Arabia and Oman have got fairly advanced plans as well. I'm not quite sure about the stats on that.
Yeah, our Gulf friends.
Yeah, Gulf countries. Yeah. Mm-hmm. So I think France has done about 500 or 600 vaccines at the moment. What advice would you give them?
Get some more.
Okay.
I don't know what happened. It's just some of these things, as you have understated, are quite incredulous. I tell people France. I told people yesterday, I think France is up to 400. It's not a race, and I just wish everybody can get the vaccine quickly.
Absolutely. Well, it's not a race. It's not a race against each other, but it's a race against the virus. So
and behave appropriately until told otherwise.
Mm-hmm. Mm-hmm. And then once Israel's fully vaccinated, I mean, is Israel going to be producing vaccine in country? Do you know?
I don't think. Well, there are Israeli vaccines in development as well at the moment, and they'll probably will at some. Well, I don't know how much we'll need them and which way they'll work, but I don't think they're going to be just. No, they're imported, and look, you've seen how we got them.
They're imported at the moment. Yeah. I mean, the Oxford vaccine is actually relatively simple to make. You know, there certainly would be the facilities in Israel to make.
Oh yeah, we can make all that stuff.
To make all that, yeah. And do you know?
I don't think we need to.
Sorry?
I don't think we need to.
Right. Okay. Yeah. Sure. Do you know if Israel's got any plans to sort of pass on vaccination capacity to other countries once Israel has vaccinated its own citizens?
Well, we don't make our own. So, but I don't know. Once we're all done, if there are spares or we can get them, we could help everybody, including our neighbouring countries, including the Palestinians in the West Bank, for example.
I would imagine they would, because what a lot of people don't realise is
because we've multiple orders. Yeah, that's what you mean.
Yeah. And you know, in conflict situations, Israeli medical facilities have looked after a lot of trauma patients from conflict in adjacent countries.
Yeah. And across the world as well.
Yeah.
Another reason we get mobilised pretty quickly. I was going to say when the earthquake in Haiti happened, the Israeli Army hospital was there well before the Americans got there, so we can move quickly, including here to vaccinate and mobilise the local medical staff.
I mean, a lot of people don't realise that Israel's done sort of surgical work, especially after trauma from war in Syria and Palestinian areas, and it's often not reported. Israel is a major. It is an advanced medical. Well, it's an advanced bioscientific country, really, isn't it? In a lot of ways. Yeah,
you're right.
Yeah. Anything else you'd like to tell us, Harvey? After that, we've covered lots of good stuff there.
I want to thank you, John.
No, thank you for coming on.
You're the upside for the year for me, and I won't tell everybody what you did for my birthday, but thank you.
You're more than welcome.
You can edit that bit.
No, that's fine. We don't edit unless we absolutely have to on this channel.
Look, there's so much information going out about the whole year, disinformation as well.
Yeah.
Hysterical news, and it's hard to find the perspective. And so when I see you on your TV channel, and now you say, okay, you don't have to watch all this. Here's the bottom line in the first 2 minutes. That's enough for me.
Yeah. Very often the bottom line is the top line is all you need.
Yeah. I can't remember all this stuff. So I want to thank you for the wonderful job you're doing for the world and for me.
It's been well, thank you for saying that, Harvey. It's good to, you know, it's particularly nice when you get that kind of feedback from nurses and doctors who actually find it, you know, find it useful practically in the real world.
And I can understand when you explain things so well. I understand them. It's not heavy medical article and I lose interest in.
Yeah, but you've got a bit of a medical background, to be fair.
Yeah, but I've got to concentrate as well, haven't I?
yeah. Great, Harvey. So thanks to your family for giving us your time, and we really appreciate it. Yeah.
Thanks to you.
Thank
Shalom,
you.
John.
Yeah, shalom. Absolutely, shalom. I hope so. Yeah, hope so.